Hello everyone, my name is Gergely. I'm a member of the Global Young Academy. I'm a pediatrician based in the UK. I work at the Birmingham Women's and Children's Hospital, and I've been involved with the pandemic from a very practical point of view. I've been working in a clinical setting since the beginning of the pandemic, and what I would like to do in this presentation is to give you a bit of a clinician's insight of the science, policy, politics interaction in this COVID pandemic. So, as you all realize, the lockdown measures are now starting to ease in most countries, and both the experts and the public now start to evaluate the government's response. The question arises whether it's too early to do so, and definitely for more detailed evaluation, we will need to gather more data and evidence. But I think it's quite important to do an evaluation in a continuous manner because we never know if there will be a second wave, and if so, when this will occur. And from the ECR's and the young researchers' point of view, what's even more important is that we are quite likely to face similar scenarios, similar crises, whether in the form of a pandemic or something else in the future. So it's good to be prepared. What has characterized the UK's response so far? Without being too political, there are a couple of things that I would like to point out from the healthcare perspective. Overall, there has been a sluggish response, I would say, compared to other countries in several aspects of the government's response. There has been a good month of delay in things like introducing proper lockdown measures, although the adherence of the public to these measures has been quite poor throughout in the UK. Another example is adding the symptoms of smell and taste loss to the list of symptoms that we want to draw people's attention to, and also the use of face coverings in public would be another example. The lack of personal protective equipment has been an issue in the healthcare setting, as well as a suboptimal trace, and isolate system. Another concern is that the rest of the healthcare has been put on standby, which is understandable in certain aspects, but it's important to mention that a lot of elective procedures have been postponed and several outpatient appointments were cancelled. We are just beginning to see, as we're coming back to normal, what the likely consequences will be, and how this will affect the health of several people. So with all that in mind, the question arises whether the public trust what politicians do, and one important aspect here, I think, is that several inequalities in the society have been amplified by the pandemic. So although it sounds great to say that we are all in this together, the tendency is that we are not affected to the same extent by the pandemic. The socioeconomic status and the ethnicity definitely predefines your odds of having the infection and how it affects your health. And of course, healthcare professionals have been quite exposed as well. The lack of transparency and consistency from politicians is a great concern. Here within the UK, it has hit the headlines that a senior advisor of the Prime Minister has broken the lockdown measures, as well as the Chief Medical Officer of Scotland, who in turn resigned. These are, of course, all damaging the public trust and morale. So this is where scientists step into the picture. within this setting, what can scientists do, and how are their actions judged by the public? I think from the scientist's point of view, this pandemic is a great opportunity, but also a great risk um, to, um, to help people gain trust in science, and things can go both ways. Um, an important question is whether we can answer all those questions that the public have using science. And a very common answer that we give to many of the questions is that we don't know, um, either because we haven't got enough data, or because science is not the right method to answer some of these questions. This is a novel virus causing a novel disease. The previous knowledge about it was really, really limited. And we, as a scientific community, need to be able to explain to the public um, how science works, what questions it can answer, and that we don't know is a common answer, and this needs to be accepted by the public. Of course, this introduces a feeling of a lack of control, which can lead to things like, conspiracy theories. But I think if we communicate clearly about this, then the public will appreciate the work that scientists do. Uh, and as I mentioned, and we'll come back to this later, some decisions cannot be guided by science alone. So definitely what we have learned is that a better communication between the science, politics, and public triangle is needed in situations like a pandemic. Looking at the possibilities and the business of science itself, I think, again, there are several learning points. The infection arose quite rapidly and spread to all corners of the world quite rapidly. And this has led to an urgent need of clinical information and results available for the benefit of patients. However, we do know that clinical studies, clinical trials take a lot longer than the scope of time that we have been operating during this pandemic. So definitely one learning point is that better turnaround times are needed, and overall the sharing of new knowledge in the scientific community can be somewhat slow in desperate needs like those raised in the COVID pandemic. If we speed up things, does that compromise on quality? Unfortunately, the answer to that is at least partially yes, it does. And some retractions from top medical journals, such as the New England Journal of Medicine or the Lancet, have highlighted underlying problems and failure of the review system that are so commonly used in science. So these issues with publication practice definitely prompt us that we need to act on this urgently, and we need to think about how things can be streamlined. One more point I would like to discuss is how politics influence science during this pandemic. I think we have observed a definitely strong influence of politics on science. For instance, in several scientific journals, the editors felt that they have to comment on politics. They almost felt obliged to do so. And this is not a judgment. Definitely, politics have impact on science. but we have seen much more of these kind of editorial papers than earlier. Another thing is that in some countries, it looks like only those advisors who are sort of loyal to the political regime and who communicate the message of the government are trusted. And this definitely introduces a lot of bias to science conduct. So who's ultimately responsible? Obviously, it's easy to say that the politicians are guided by scientific advice, and therefore it's to some extent easy to blame scientists. However, again, I think as a scientific community, we have to be very clear about the fact that uh, some decisions, if not most of the political decisions, cannot be guided by science alone. Uh, we can give advice and we should give advice as scientists, but there are many other factors which then um, contribute to political decision making. And there is definitely a clear distinction, there should be a clear distinction between scientists and decision makers and their well-defined roles. And how difficult these interactions are becoming are probably best reflected by a recent quote from, again, from a medical journal, from the editor of a medical journal. So I'm just going to leave this quote for you to read um, to end my presentation. Thank you for your attention.